Hello, my name is Dedrick Moulton. I am the Division Director of Pediatric Gastroenterology, Hepatology, and Nutrition in the Department of Pediatrics at LSU Health Science Center. Today, I will speak on the topic, the diversity framework at LSU Health. So what is diversity? Diversity is differences. Diversity is everything that we are and that we are not. Diversity defines us. Diversity is recognition and appreciation of our individual differences. Diversity are those things or differences that make us unique, such as race, color, ethnicity, nationality, language, sexual orientation, religion, gender, etc. So, why does diversity matter? Diversity embodies inclusiveness, mutual respect, and awareness of multiple different perspectives. It encourages multicultural exchanges of ideas, which subsequently perpetuate innovation and creativity. Diversity enhances our personal development, and diversity improves productivity. So, how does diversity look? Well, we see it every day. In our society, we see children playing soccer that demonstrate diversity, or we may see it in our third-year pediatric residency class here at LSU New Orleans. Let's take a look at the demographics of diversity in New Orleans. We see here depicted that there are various races that make up the community of New Orleans. If we look closer at the demographics of Children's Hospital New Orleans in 2018, we see that, once again, a similar makeup of various races. So how can we ensure that we resemble our community and that we have a team that can serve effectively to meet the needs of our community? One way is to recruit minorities, underrepresented minorities that are the best and the brightest. Frequently, there are great efforts that go into recruitment of minorities. However, there's failure present in the areas of retention. When we see a work culture that does not promote inclusion of diversity into the mission or the fabric of the institution, this may lead to frustrations in the culture of this environment. And then barriers may easily be seen in the workplace that begin to stand out. This may result in those frustrations that lead to failure to advance academically. And these failures and frustrations may lead to underrepresented minorities' poor job performance and subsequent loss of those talented individuals. So what is LSU Health New Orleans' position on diversity? Greater than 20 years ago, the Office of Community and Minority Health Education was established with a focus to develop and support health professions pipeline for underrepresented minorities. The mission expanded to support diversity and inclusion in the School of Medicine in the areas of admission, equity and inclusion of curriculum resources, institutional policy and faculty recruitment and engagement, and supporting GME program development resources. At its core, the Office of Diversity and Community Engagement is designed to promote and embrace diversity and cultural competency in the School of Medicine faculty, staff, house staff, and the student body. Furthermore, it is there to expand the outreach initiatives to develop and strengthen mutually beneficial relationships with our community partners. So what are those directives that are established within the Department of Pediatrics? I'll list a few. Assessment of cultural competencies within the Department of Pediatrics. Faculty, resident, and student education on diversity, equity, and inclusion. Department of Pediatric faculty assisting with resident recruitment of talented, underrepresented minority applicants. Development of cross-cultural mentors for residents in the pediatric programs. And social networking. We'll take a look at each of these a bit closer. We begin with cultural competency. Well, what is cultural competency? It is actually the willingness and ability to effectively interact with people from diverse cultures and backgrounds with respect that they deserve and that they perceive as service which meets their standards despite their backgrounds or cultures. So cultural competency is really how we interact with others. First impressions are significant. Some call them snap judgments. Sometimes first impressions are correct, while other times they are not so. When they are incorrect, the path that sometimes may result from those failed first impressions may result in failures to achieve our mission of treating patients with kindness, respect, and the standards that they deserve. We aim to build cultural competency, assessing our capacity through surveillance of our cultural competence. The surveillance studies will simply look at where are we now? What is our baseline? And then later in the year, where are we going? Did we make progress? We'll also address areas of medical education. The focus will be on faculty, residents, and students. On the faculty level, we'll incorporate diversity champions to provide short TED Talks on issues that are related to diversity. Amongst the residents and students, interested and enthusiastic faculty members in the areas of diversity, equity, and inclusion will present various topics, and this will be integrated into the normal curriculum for the residents. In the areas of resident recruitment, Department of Pediatric faculty will assist with recruitment of talented underrepresented minority applicants. We'll establish a directory for the pediatric residence department of those who are interested and have enthusiasm about bringing in those talented individuals. Resident mentors. Development of cross-cultural mentorships are significant. They will provide an ability to or aid in navigating unique personal cultural issues that may exist that may lead to feelings of marginalization. It will provide guidance on integrating them into pediatric residency programs, including participation in academics of academic advancement and opportunities toward leadership. And further will assist in navigation on key decisions in medicine, such as career choice, whether to go into a research career, academic, private practice, or whether to pursue further fellowship training. Social networking is important. We aim to establish gatherings to introduce residents to faculty at large on the LSU and Children's Hospital New Orleans campus. This opportunity will focus learning about the faculty and an opportunity for residents to learn, for faculty to learn about residents. It will be an opportunity for residents to meet their mentors. It will establish opportunities for residents and faculty to develop potential collaborations in areas of clinical research, clinical care, or community engagement projects. We end with, diversity is who we are. We aim to create and maintain an environment that recognizes diversity and inclusion as a key component to the success of our institution and to the mission that we've established. We want to create an environment for our patients that is safe and filled with respect and the dignity that they deserve. Thank you for participating in this series. I hope to meet you all soon.